When I am seeing my patients, for the first time or getting started on a treatment plan, we talk a lot about long-term success because so many of us who have struggled with our weight have thought about short-term outcomes. We've thought about how can I lose 10 pounds before summer comes? How can I quickly get this off? And if you look back at a lot of the treatments, prescription or otherwise, that have been out there to help with weight, a lot of them were considered short term. So our very first medication that was approved by the FDA way back in the late 1950s was phentermine. Phentermine is a stimulant. It's a similar medication to a lot of our ADHD medications, and it reduces appetite. It was approved for 3 months of use. So the idea was that you would use this medication daily for 3 months, and then you would be all fixed. You would have lost your weight. You would be totally fine and go back to a nice, normal, healthy life at a nice, normal, healthy weight for the rest of your life. That was the idea because we didn't understand the science of that. Many of the different sort of diet medications that have come out over the years, again, prescription or otherwise, have also been really focused on short-term outcomes. So you think about products like Garcinia Cambogia or Fen or any of these treatments was really about short-term outcomes. How can I get this weight off quickly? Similarly, products like Hydroxycut, they're thinking this is how you'll look after 3 months, right? We see our before and after picture. You're automatically fixed and better. That is not how our bodies work. Our bodies want to regain weight. They're designed to do that, which is protective in the history of humankind to protect us from famine, to protect us from starvation. Some bodies are better at holding on to weight than others, but our bodies want to regain weight. And the mechanisms that they use to do that are they tend to increase our hunger after we've lost weight, decrease our fullness and satiety signals so that we don't feel as satisfied with the same amount of food, and drop our metabolic rate. And so when we're thinking long-term success, I want to know, what has somebody tried before? How did it go? How did it feel? And what happened afterwards? Because a lot of people will tell me that they lost weight, then they gained it back, then maybe they lost it again, and then maybe they gained it back. That is someone who is typically going to need more of an intervention than simply looking at lifestyle because they have tried lifestyle before and has somehow failed them. Whatever we do to lose the weight, we need to think of as a long-term solution. And that is a big one to wrap people's head around. Again, because we come out of many, many years of thinking we need a short-term intervention, a crash diet. I'm just going to do keto for 6 months. That's what a lot of people tell me. It worked before, and then I'll be fine. But the natural story of humans is that we almost always will regain the weight. And so we really want to think, what can I do long term? Whether that's looking at the way that we eat, the way that we move our bodies, the way that we manage stress, because stress will always come and go in its intensity. How do we focus on sleep? And then what else do we need to add? Do we need to add medications? Do people need a surgical intervention? What else will be helpful for that person? But again, thinking about it for the long term. When it comes to thinking about medications for the long term, again, that's another area where it's really hard for people to wrap their brains around, I might need to take this medication for the rest of their life. And the way I often explain that to people is if somebody has bariatric surgery to lose weight, let's say they have a gastric sleeve procedure, we don't go back and open up the stomach again after they've lost their weight. We think of that as a long-term change to their body. And similarly, if they are using medication to help reduce weight, we need that effect long-term. It does take a lot of my patients a while to wrap their mind around that. But usually when we look at it from people's lived experience of having lost and gained weight in the past, it makes more sense. We need something that works for the long term, not to just crash diet and try and get the weight off as quickly and as fast as possible and then go back to normal.